Hi, my name is Leslie. I've never made a YouTube video of myself before. I've only made one other. I'm going to try to go through this pretty quickly because I really have a bucket list of medical problems here that I have and that I deal with every day. And right now I'm a little bit depressed. My boyfriend is soon to be deployed. I've been married twice. I'm 28 years old. I'm separated and hopefully be getting married after this deployment. But I've been a heavy alcohol user since I was 14 years old. I started trying alcohol when I was 12 years old. I was diagnosed with depression when I was 12, but then when some serotonin drugs, some antidepressants went kind of lopsided on me. I ended up in my first institution at the age of 14. I was diagnosed with bipolar disorder, bipolar 1 or bipolar unspecified. Sometimes it's called manic bipolar. I am normally a very chatty person despite all the medications I'm on. That is a very important part of this video. I wanted to talk about all the medications that I'm on right now. This doesn't mention all the pills that I've taken over the last 14 years being a guinea pig for pharmaceutical companies trying to change my meds as my brain chemistry changed, because bipolar disorder is a chemical imbalance. And but mostly I stay manic. I stay hyper, like a sugared up kid or a person with ADHD. Currently, I'm taking Depakote as a bipolar mood stabilizer. I'm taking Klonopin, which of course is for anxiety. I've been taking that for 8 years. I take Singulair for bronchitis, which is pretty much chronic. I take Protonics, which is for the stomach, colon spasms, pains, and to prevent ulcers from alcohol use from bleeding and causing cancer and things like that. Also, I take estrogen because 5 years ago I had a full hysterectomy, which means that at 23 years old I entered into what's called surgical menopause. I don't make any of my own female hormones anymore, which is pretty much a wreck. Bipolar, alcoholic, okay, no female hormones, if I don't take the pills. But so I'm pretty much of a mess. Redheaded, South Carolina girl. Okay, let's continue. I take high thiamine also for stomach and colon spasms. I've been taking Cambrel, which is for alcohol dependence. It actually takes away your desire to drink. It seems to work really well. I've been getting clean for a while. I've taken amitriptyline also because I had entered into my depressive state, which is during the winter last year, and it seemed to kind of linger. I went into depressive psychosis and was re-hospitalized for the 14th time in 14 years. So on average, one time a year, I have to be hospitalized for at least 3 days. I take orphanedrine, which is a muscle relaxer for muscle spasms, pain due to fibromyalgia, ibuprofen, tramadol. My doctor took me off the tramadol because in 2015 I started having complex partial seizures, which are also called focal seizures. I was taken off my tramadol recently, about 3 months now, put on Norco, which I've been a chronic pain patient for at least 5 years, although there have been some stops in pain meds, and I never seem to have any problems up until I started intranasally using pain medication, which I'm not proud of. The only thing that I've ever been really addicted to, besides cigarettes and chocolate and alcohol, was my drug of choice. It always has been, but I did not realize that the tramadol had taken the place of a hydrocodone. But the tramadol, my doctor said, was causing the seizures. he took me off of it, put me on Norco. I do admit that I'm more than just an alcoholic, that I do have an addictive personality. So I was on Norco. Then I started seeing a psychiatrist. The psychiatrist put me on Intuitive, which is an ADHD medication that they say is used for other purposes, to start weaning me off the Klonopin. I was very uncomfortable about that because, like I said, it's been my security blanket for 8 years. Before that, I took Xanax for a year, but it just made me ill and sleepy, groggy all the time, just really mean. When I stopped the tramadol and started taking the Norcos, back to that, I continued to have seizures. And the Norcos were not helping my pain. I have SI joint dysfunction in my right hip, which can sometimes cause my right leg, to be a quarter inch longer, or a quarter inch, up to 3/4 of an inch longer or shorter than my other leg, which means there's a lot of wear and tear in my right hip, and I'm only 28 years old. Like I said, I also have fibromyalgia, like I stated, and I have facet joint damage in my lower spine. It's basically on my tail. First thing in the morning, I get up, I hurt. It takes me a little while to get up most mornings. That's my med list. It's, this is my med list right here. That's insane. When the problem, while I'm making this video, was because I just recently started using Kratom. And I had come down with a cold a couple of days before I started using it. I had used a tiny little bit at a band meet several weeks ago. And I tried a small amount, which anyone that knows about Kratom knows that it has a stimulating effect. But where I had been a chronic pain patient and also had been addicted to methamphetamine for 6 months in my life, and was at one point in my life an intravenous drug user, opioid abuser. Still in denial. Was still in denial up until recently that I had ever had opioid dependence. Which I'm still taking that all in. God was my witness. I did not know. When I was in high school, I started snorting pain pills. It wasn't something I did regularly, but then it was something, if I could get it, yeah, I'd do it. I never considered myself addicted because once it was gone, I never did have any withdrawal symptoms. Being somebody that suffered from anxiety for a long time, and like chronic anxiety, I have generalized anxiety disorder, along with the bipolar. That's what the benzo's for. I had a lot of trouble in my life. But I have 2 daughters. One's 10 and one just turned 6. And I lost my first daughter to other relatives on the other side of the family right before she turned 4 years old because of my alcohol problem. The Cambrel, which was for the alcohol dependence, it actually did, I noticed right away that it did take away my alcohol cravings. But then sometimes I would still choose to drink, and it's not something like, antabuse, which makes you very, very sick if you drink while you're on that, which I've taken that before while I was pregnant with my second daughter. And I did not drink, so thank God I didn't never have the reaction to that. But back to the Norco. I started taking about 75 milligrams of Norco a day. Most of it was intranasally. So about a week ago, I started developing a really bad, bronchitis, allergy, irritation, just my head was really packed full of junk. And my pills were gone. And then I know I can admit that I've probably been pill sick at least twice in my life, but it was nothing like what I've been going through last week. Already having seizures. I don't think if I was on the Depakote and the Keppra, which are both seizure medicines used for two different purposes, in me, that I would have had to be hospitalized for this. I've had chronic diarrhea for 5 days. I haven't been able to eat. But in the last 3 days, the only time that I have any relief, as soon as I wake up in the morning, diarrhea. And it's just got to the point where I'm in pain. The Kratom has taken away the pain. I actually had no pain the first time that I actually went and got 30 grams of Kratom from a vendor. It's legal here in Virginia. And I took a pretty modest dose. Just stuck the powder in my mouth. I was very desperate for anything to help me. It wasn't that addictive side of me so much as it was that the pain, the chronic pain, causes a lot of depression. Try to keep it together here, because I'm hoping that maybe this will help somebody else too. I'm not saying that I recommend that anybody try anything to escape something else. But this is just my story, and but I'm raising one daughter. She's in school, and she's brilliant, left-handed, like my dad. Okay, sorry about that. But the only time I've had any relief from the diarrhea is when I take the Kratom. It usually lasts me about anywhere from 3 to 5 hours. I dosed pretty heavily that first night, which was a mistake. You should never start out with more than 1.5 grams, in my opinion, especially with my body weight. I weigh about 130 pounds. Now I probably weigh about 125 pounds, I'm guessing. But just start small and just work your way up. The stimulant effect isn't like a nervous type stimulant. I'm not an upper type person. Even though I did develop an opioid dependence, it was not because of the upper side of that. And even though I did have a meth addiction, it was also not because of the upper side of that. Like a person with ADHD that takes a stimulant to relax, opioids and cocaine and uppers tend to calm me down. Some people really don't like stimulants because of what they do. I don't drink coffee. Well, I do drink coffee, but I don't like to drink coffee, but I do, because I have a real great lack of motivation because of my pain and because of my loss. And but the only time I get any relief from the diarrhea is the Kratom. Any time that I feel like I even want to drink anything is when I'm dosing. And I've been drinking orange juice, which is probably not helping the situation with my bottom. But it does not intensify the effect so much as it brings it on quicker. It gives me relief quicker. I do not feel high when I am on Kratom. I just feel relaxed. It is a sedative in higher doses. These aren't dangerously high doses. These are just, and I've always thought it was kind of strange that low it was a stimulant and high it was a depressant, like a downer. Downers have always been my drug of choice, and that's why I think I turned to alcohol at such a young age, because I had so much agoraphobia, social phobia. I even have lost and gained weight, mostly lost weight, for about 15 years because I have phobias related to food. I'm not a well person. But I will say that I feel like God has given us these things to help us. And I feel like pharmaceutical companies are working for the enemy. All these things right here, they have very serious side effects. Some of these medications are the same types of medications, which can be very dangerous. Anticonvulsant or anti-seizure drugs can cause seizures. Tramadol lowers your threshold for seizures. So my doctor said it may have been what caused the seizures in the first place, and then even after stopping taking it, that I may have seizures for the rest of my life. But luckily, the Keppra has kept me from having but 2 very, very light seizures. Thank God. My daughter goes to school. Thank God. I have never had a seizure alone. Thank God. I just feel like God's watched out for me, and I do plan on not taking as much as I did that first day. I've been dosing about 1.3 grams, about 3 times a day. Except that first night, when I got back, I didn't realize I'd already taken about 2.3 grams. I ended up taking about 7. And the next day I woke up with a terrible headache, the Kratom headache, the Kratom hangover, as some people call it. But I just want to share this experience, and I do think that it's worth a try. My sister is tramadol dependent. Tramadol is very much like all these other things. It's just brain drugs, almost like not placebo, but they make you think you're not in pain. They're not actually analgesics like hydrocodone, oxycodone. But Kratom is a known analgesic, which means that it can alleviate pain, nausea. Although some people that start off a little bit too quick with too much can develop nausea because it is raw plant material. That's what I take, is the powder. I take Bali Premium. And I just feel like I'm starting to know what my dose should be. And I've just watched an amazing video. I think I'll be able to comment, maybe try. It's called 100 Facts About Kratom. And it's by it's an Irish psychiatrist or mental health physician of some sort. He's very, very Irish. You'll recognize him right away. Watch that. It's 100 facts about Kratom and its uses. And I just think that it is a very safe alternative. And I do pray, not for myself so much in the last couple of days, because I feel like I am over that. I will be going back to my doctor who's been prescribing me the Norcos, telling him that I will not be taking any more addictive medications. Pretty soon, hopefully, with the help of the Intuitive, I can be off of all addictive medications that are pharmaceutical. And if Kratom is addictive as coffee and cigarettes, I will be more than pleased with that. I thank you for listening. If you've managed to listen to me, have a pity party. But I'm just, if anybody can identify with all these problems, then you'll know I get relief from the Kratom. I just think that it's worth a try when you're in as much pain as I have been most of my life.